Hello everybody and welcome to your daily step 1 question. If you find this content useful, then like and subscribe. We'll dive right in. A 2-week-old infant is sent to a pediatric clinic due to leakage from the umbilicus. The stump fell off 4 days ago, but then they've noticed this clear yellow fluid dripping out whenever the intra-abdominal pressure is increased, whenever the baby is crying. And everything else is appearing relatively normal. There's swelling and tenderness, and the lab findings are relatively normal. Which of the following is the cause of the umbilical findings? So I'll give you a chance to pause, check these out. The correct answer is going to be the persistence of the Urachus remnant. All right, so what's happening here is we have this clear yellow fluid, which means that there's urine coming out because of the connection, which is still intact between the bladder and the outside world. So normally in the 12th week of gestation, you form the urachus, the allantois is obliterated, and then that forms the urachus, which then becomes the median umbilical ligament in normal humans. Okay, so if this obliteration fails, then a patent urachus persists, and that allows this opening that the urine can go out from the bladder and leak out, and that's why you get this clear yellow fluid. So always think of the persistence of the Urachus remnant when seeing yellow fluid come out of a baby's belly. So coming out of the urachus. Okay, so why is it not the other choices here? So patent urachus, yes, would come out with this yellow fluid. Omphalitis would have purulent drainage, and they would have some infection signs. Patent omphalomesenteric duct would have intestinal leakage, so there would be no pee. You'd see no yellow fluid. Urachal diverticulum, that would be present with some UTI symptoms. As you can see here, you have kind of that outpouching here, this diverticulum near the bladder, and there's not this patent urachus there. So that's why it's not that answer. Incomplete abdominal wall closure, you just see an abdominal defect. So you can take a look at some of these other explanations, but essentially it's the yellow fluid which gives it away. There's no visible protrusions, there's no history of UTI, there's no other infections going on, and so it's going to be the patent urachus, which is caused by the persistence of the Urachus remnant. So hopefully this was helpful. If it was, like and subscribe.